This CSOE COVID-19 is a UNFPA funded program and serves to intervene in the COVID-19 pandemic. Already we have a stressed health system, and at the same time, the gain we have achieved in SRH and reproductive health as a whole, we don't want to go down. So the COVID-19 CSO intervention helps us actually to see that yes, people can actually access services, information and services despite the pandemic. Recall that the pandemic led to lockdown. Nobody can come out. And the lockdown has actually brought a lot of socio-economic issues.
We coordinate the agencies with the communities, with the facilities. One is to link whatsoever support is coming from whichever one to the benefit, to those that will benefit for it. And those are the citizenry of this country, especially those that are residents of FCT.
You see, the issue with gender-based violence is people are always afraid to report, because if you have been violated for any reason at all, not just on the side of the woman, but more of the women past, you should be able to report so that action must be taken. There is a policy on all this. If you have done something wrong that is not good in terms of GBV, you report to the appropriate quota, then they will enforce the law on you. And this one will reduce the effect of the frequency of having or tolerating gender-based violence. So in this particular project, apps was launched, Test for Life, where you can easily text to, and you are encouraged to go and report. And you are also encouraged, using these apps, to report to where you can be provided with services. And then services can be given to you. We all know the consequences of being raped. If you are raped and you are not being taken care of, it can lead to all sorts of things, infection, emotionally disturbed, some even death. We have heard of cases of death and all that, so depending on the extent of rape. So by this intervention, really, things are in place. People are encouraged to speak out if anything happens. And not just speaking out through the police, we are also offered opportunity to go for treatment.
We are having many issues of violence, but when this program commenced, in fact, we have been going to training with my people, on which we are in the same training today. In fact, when we came back, we have to, extend the message to our people, because we have, like me, I have cabinets. I have to sit down with them and explain to them the issue of violence has been renewed now. Anybody that is in court is directed to the government.
In our own facility, as a stakeholder of the PPFN, we did an sensitization and advocacy in our facility, which we always tell them at the program table, immunization session, ANC session, to get across to them, to tell them what is gender-based violence. That is a case that is not supposed to be silent, a case to be exposed. By the time you are telling them, they go out there, which they also tell their neighbors, it makes the case to reduce. It reduced the case dramatically, especially this year when we get this Test for Life. We give them the phone number that if you have any case of rape or assault between you and a husband or a neighbor, please, they should report. Call this number, we will respond. I think the program really gives them a sense of recognition, which reduced the case